have been working at Huntington Hospital now for 10 years. I completed my residency in pediatrics in Las Vegas, Nevada, which is where I grew up. And then I moved to Los Angeles in 2005 to join my fiance, who was here, to finish my fellowship at UCLA in neonatal perinatal medicine. I finished fellowship in 2008, and then I decided to give research a try. I was doing a successful research project at the time on adrenal gland development, and decided to do that for a couple of years. And then about 2 years into it, I decided my heart was really with the babies and taking care of patients. So I left UCLA in 2010 and joined at Huntington Hospital, where I've been practicing as a neonatologist in their unit there. And in 2011, I took over as the medical director for the group, and have been doing that ever since. Currently, I work about 50% administrative time and 50% clinical. So I kind of dabble in both sides of the field.
How did you get into medicine? Were you inspired by a woman to enter the field?
Ever since I was a little girl, and everybody asks you in kindergarten, what do you want to do when you grow up? I always said I wanted to be a doctor. That was the only thing that ever crossed my mind. And all going through school, that was the only thing that I ever worked towards. I never really considered anything else seriously. Actually, when I was in grade school, my dad worked nights and my mom worked days. So there was a period of time where they had an overlap in their schedule. So my mom would actually drop me off at the hospital where my dad worked in the mornings, and I would sit there in my little uniform and listen to the doctors do rounds in the neonatal ICU. So I did that for probably 5 or 6 years, and it was really exciting to me to listen to them talk and go back and forth and debate over how to take care of these little babies, and actually get to see them from time to time. My dad would walk me through the unit. So I was actually inspired by my dad to, really enter into medicine. And it was never a consideration that it wasn't something that I could do because I was a woman. That never really entered my mind until I actually got into medical school, where you see it's a little bit different world being a woman in medicine.
What do you think it means to be a woman in healthcare today?
It's medicine these days is a little bit different. It's not you have your own patients, you kind of carve your niche, you have your own practice. It's very different and hard to create your own identity within medicine these days. There's a lot of corporate medicine out there. There's a lot of practices. People don't tend to stay with one practice for a lifetime. So it's really a challenge just in general, I think, for anyone to create an identity for themselves as a physician in a major role. And I think more so for women, because there's also still, maybe stereotypical, but women still having the challenges of being mom and wife at home. So without fully dedicating yourself 100% to medicine by itself, it's really hard to kind of balance the two and create an identity for yourself as a woman in medicine in a power position, and then also be successful at home.
What are some of the challenges of being a woman in your specialty and just the healthcare field in general?
Well, in medical school, it was really tough. Most of your professors and teachers, at least when I was going through medical school, in the early 2000s, it was still a lot of older male professors that didn't have a whole lot of respect for women at that time in medicine. Felt like, there was still the stereotype that women should be home. If you are a woman in medicine, you should only be doing pediatrics, which was fine for me because that's what I did. But I think the hard part, especially for neonatology is a lot of hours. We do the 24-hour shifts, the 36-hour shifts, a lot of call in the hospital and a lot of time away from home. So it's really a challenge to kind of force yourself to strike that work-life balance, to really have to be able to shut yourself off so you can be home and take care of your family. It's easy to get invested in work and be at work and stay there for endless hours because those patients are always there and they need you. But it's really a challenge to kind of be strict with yourself and strike that balance. Otherwise, the risk of burnout is high.
And on that note, what are some of the positives that come from being a woman in medicine?
I think the advantage, especially for neonatology and working through the unit, is when I talk to other parents, other mothers in the unit, I can speak to them from experience as being a mother. I never had a child in the intensive care unit, but I am a mother. I can empathize with them with some of the emotions that they may be feeling. I've gone through the experience of breastfeeding and the challenges that comes with that. So I think being a woman in neonatology gives you a unique perspective when you talk to your families and being able to empathize with them in the perspective that they come from.
What advice do you have for women who may be applying to medical school or entering the medical field for the first time?
Medicine has, like I said, changed so much in the last 20 years that I've been a part of it, that you really can do anything you want with medicine. If you want to be at the bedside just taking care of patients and doing that day in and day out, you absolutely can do that. If you want to do a little bit of both, like what I do, some of the business of medicine as well as some of the patient care, you can do that. If you only want to do business of medicine, which is a huge field these days, it's ever changing, with the laws and regulations that are coming about with the ACA and different governmental regulations. There is so much that you can do in medicine. The field is wide open, and you really don't have to limit yourself anymore to just being in a clinic or just being in the hospital. And there are so many opportunities that if you decide that you don't want to do healthcare anymore, you don't want to be seeing the patients, you can do another aspect of medicine, and you're really not tied down to one aspect of it. So, regardless of what you choose to do, there's job security in it, which is something that everybody is kind of looking for, especially now in the times that we're at, which is probably going to last for a little while. So, the opportunities are limitless. And if you have a passion for it, it's something that you're interested in, you should go for it. There's no reason why you can't do anything that you want to do and reinvent yourself within it.
How do you think women physicians can best support fellow women physicians?
I think the biggest thing is knowing that you have a sister in there with you. We're all going through a lot of the same stressors, a lot of the same frustrations, and knowing that you have somebody else that's going through it with you is huge. I could talk to some of my male colleagues and tell them what I'm going through, and it's really just not quite the same. So it's really nice to be able to talk to somebody who's right in the same playing field with you and really understands where you're coming from. It gives you a different sense of comfort. Just being able to talk to somebody else and tell them how you're feeling and what's going through your mind. That's huge in supporting each other through these hard times.